Ask people to take their seats as quickly as possible, please. We're in the final straight, the home straight. Okay. I hope people enjoyed and engaged thoroughly with the workshops, and I'm certainly anticipating receiving reports about each of those workshops and to hear what discussions went on and what particular next steps we are in each of these areas, which is obviously vital. And obviously another vital area is one that we'll be discussing now in the second session of today, in the final session of the conference as a whole, and that's to talk about adolescence. We all know how important adolescence is. Certainly there's a lot of evidence in the registry that it's a particularly vulnerable time for people with cystic fibrosis in all sorts of ways. It's a particularly vulnerable time for everyone, but people obviously with cystic fibrosis are particularly vulnerable through this period. There's a lot of great work going on across the UK and globally focused on this area. I think one of the challenges is about really how we can learn what practices, what methods, what interventions work more effectively than others. It's an area that, reflecting my comments this morning about the work the Cystic Fibrosis Trust is doing to galvanise and mobilise all our resources around fighting for a life unlimited by cystic fibrosis. Certainly adolescence will be a key theme within that, and we are looking to bring expertise across the clinical community, but also from the wider community, adolescents themselves and carers and others, to try and develop interventions, research questions, support and information that can really help enhance this period of adolescence, to move from that era of vulnerability to one that really brings great potential for those going through that period, and absolutely ensuring their health and well-being is absolutely paramount. We've got two speakers in this session, and I'm going to invite Thia Richards in a moment, a parent of a cystic fibrosis adolescent. Thia, in a moment I'll get you up onto the platform to give your perspective. But before that, we want to play you a film. Because of cross-infection issues, we haven't actually got an adolescent with cystic fibrosis in the room. So the next best thing, I've got many hopefully joining by the live streaming, but the next best thing is that we produce a short film, which hopefully gives an insight from those who are living through adolescence about life with cystic fibrosis. Thank you.
CF doesn't really impact on my life, because I've always been brought up with the mantra, you know, you live with it, it doesn't live with you, type thing. So, like, I'll be able to play rugby on the weekends, go training, you know, weekdays, run around the field with my friends at school, well, when I was at school. Yeah, I've never really let it hold me back. I know that's a bit thingy, but it never, you know, has managed to stop me from doing anything that I've wanted to do.
How do you sort of incorporate your day-to-day sort of treatment into life? In
order to incorporate the treatment, I have to get up earlier. So my friends and everything will be going, oh yeah, get up at 7, go to school. I'll be like, oh, I have to get up at 6:30. Things like that to fit it all in. And then, like now, while I'm doing my A-levels, it's sixth form, homework, you know, either training or not training, or training, come back, do medication and things like that. So you just have to kind of think ahead before you organise your day, I suppose. I think when I was younger, you know, I knew everything was going on, I knew what I had, I knew what it meant, but like I hadn't really had the experience, whereas now I'm older, like, I have had infections, I have been an inpatient in a hospital, and I thought, oh, hold on, you know, this could, well, this is there, it is present, it is something to consider. So yeah, definitely, as I've got older and got the experience with it, I think, well, yeah, I really do need to keep on top of it, because otherwise, yeah.
And so what are your plans for once you've done your A-levels, do you want to go to uni?
Uni does really appeal to me, if I'm being honest. I don't really know what I want to do specifically. I have a general idea. I'm just going to try and get as qualified as possible, and you know, see where I go from there, type thing.
And do you think having CF would affect where you would apply to go to uni?
Well, yeah, because at the moment we live in Essex, and London, they've got a lot of good hospitals in London, and so that's quite easy to get to. But if, you know, there was a university in Manchester, if you're up in there, it would be, you know, you'd have to relocate hospitals and things like that, and your files would have to get sent up and things. So yeah, it is a consideration, yeah.
Regardless of having CF, what do you think is the most stressful thing about being a teenager?
Balancing a social life, education, homework, and everything, all trying to fit it into one day and trying to make sure, you know, nothing gets forgotten and nothing gets just balancing it all out, making sure you do everything.
Yeah. And how are you feeling about transition? Is that something?
Yeah, and it doesn't really faze me. I don't want to come off overconfident, but I've been able to talk and communicate with doctors and nurses and physios quite well, because I've always found it interesting. I've always asked the questions. I've always wanted to know what's going on. Yeah, so I've always been there speaking to them, not sitting there on a phone or whatever, while you let your parents do things. So yeah, I was well equipped going into the adult part of things.
And what about cross-infection? Does that have an impact on you?
Yeah, with cross-infection, I remember talking to the nurse at school about things. So I had to ask her if there were any other patients or people with cystic fibrosis within the school. I think there might have been one, I believe, but no, not really. It's never been a thing. I've always they've not been around me really, and I've never spoken to anyone with cystic fibrosis or anything like that.
Okay, so you don't chat to people with CF online or anything like that?
No.
If you wanted someone who doesn't know anything about cystic fibrosis to know about it, what would be your sort of main thing to tell them?
That is just a little anecdote. In A-level biology at the moment, the whole topic 2 is on cystic fibrosis. Yeah, and so they're reading things like, I know for some people this is the case, and like the average life expectancy is 40, you have chronic diarrhea, you know, they're not often small and they have to spend a lot of time with their physio. Yeah, sometimes with people that is the case, but for me it's not. And so I don't want anybody running around thinking that I have chronic diarrhea and the pity if I'm going to die at 40 and things like that. So I'd say it's not always, you know, there are exceptions to the rule. It's not always, you know, what it says on the paper, if you know what I mean.
And if you wanted to give a message to younger people with CF, would you have anything that you'd like to say? Stay as active as you can, I suppose. Take up a sport. I mean, I was in the position where I could play rugby. I was never good at it. I'm still not the best at it, but yeah, I enjoy it, and I'm at the stage now where I quite look forward to going and things like that. I mean, I've in the past, I've been like, I don't want to go rugby, mum. I can't be bothered. They're all better than me. But I just kind of kept with it, even through education, and I'm really enjoying it now, actually. Yeah. And do you find it helps with things like your physio?
Yeah, definitely. Physical activity will help with the physio, and also the social side of it. Make a few new friends, I suppose.
Hi. So, this is what, I was given a choice of templates today from the CF Trust, and I thought this is the most appropriate one because it is a fight we must win. So that was a bit of a no-brainer, really. So I'm the parent, and my job today is to give you an insight of the life of an adolescent from a parent's point of view, and an adolescent who has cystic fibrosis. So, our story, where I'm going to tell you what my job is today, which I've just done, who I am, a little bit about the lead up to where we are now, where we are at age 14, and that will be about it. Better? Okay, yeah. So, who I am, I would be far more comfortable talking to you about international labelling compliance, but I'm not going to, because that would bore you. So I'm Thia. I'm married to Nick for 22 years. I'm a product technologist for Marks & Spencer for 23 years. We live in Buckinghamshire. We are parents of 2 adolescents. Aren't we lucky? Ella, 17, and Edward, 14. And we have 2 cats. Okay, so the lead up to where we are today. So our daughter, Ella, was born in 1998. A normal birth, bouncing baby girl. Normal toddler issues, fussbot over food, you know, the usual head-to-head confrontation, nothing different. Edward was born in the year 2000, normal birth, huge bouncing baby boy, normal issues, no normal issues until day 5, when it felt like this happened to us. So 1 month in hospital, lots of investigations, major bowel surgery. We were told that Edward had a condition called cystic fibrosis, which we had no idea even existed before that. We have absolutely no idea. And I just made an extra note here to say that the length of time it takes people to get out of that whole train crash situation really probably affects how they look after their kids. And some people may dip back into it, depending on how difficult their kids are being or not. So I remember thinking, this is Ed, I'm going to be so much more laid back about baby number 2, and if he doesn't want to eat, I'm going to take it away. I'm not going to have any confrontations. So that went out the window completely. But luckily, I didn't have to worry because he was a good old eater, and I think I went a bit OTT. So where we are now. So I've split this up into kind of 3 sections. So a big part of our lives is hospital visits. As an outpatient, thank God, so far. So the effect on school, which he loves, hooray. But we have got GCSEs coming, and we do have to juggle our work schedules to try and get him there. And another effect is that mum gets it in the back of the neck if the appointment is too late, and he doesn't miss any school. Ed likes going to hospital. I think he's a bit of an exhibitionist. He likes the attention. But as he gets older, there's no more stickers, there's no more balloon tests, and I think he quite misses that. There is always the visit to the sweet shop afterwards, though, and I don't think that will ever stop. Suddenly, everybody's talking to us about transitioning. Have you been transitioned? No, I'm not sure. It's a very popular word. So obviously, we're gearing towards moving him from a child team to the adult team. And there's lots of scary things you hear and unknown things, which is also scary. And he likes his team. He's comfortable where he is. And you hear things about wards not being geared up for young people, being full of much older people, lack of facilities for people to visit, for parking, parents having to go home, not being able to visit their children, which is all true in maybe one instance, not the case, as I'm sure in the majority, but it's all the unknown, and it adds another level of pressure. The next segment is around treatments. So no more physical physio, and he actually misses it. So there's no contact between parent and child, and that was quite nice, really. It was quite a nice way to finish the evening. But he's nearly 6 foot now, so it would be a little bit difficult. So the whole transition, moving from parental giving of medicines to self-administration, which leads to reminding / badgering, constant. And the question is, when do you stop? When do you stop badgering? So much so that you irritate them so much that they start rebelling. And most of the time, it's mum who does the badgering, because mum is the one who organizes everything. So it kind of makes mum even more of a bad guy. And the classic teenage adolescent theory of rebelling. Now, touch wood again, we've not had it bad so far. So rebelling, i.e. not doing things properly or not doing them at all, and refusing treatments, which we have had experience of friends of. And the parents have had to basically back off and stop you can't force your child to take their medication, watch their child become ill, and then pick up the pieces and slowly nurture them back again. So as I say, so far, we've been lucky. So the last section is pressures, which is additional to the normal adolescent turmoil that's going in within them. So this is a bit of a weird one. It's all about eating. So I was told, I remember it, to throw out the rule book. Basically, if they want to eat, they can eat what they want. And that caused a lot of judging by some other parents, raised eyebrows by other mothers. And then it causes issues because, well, why can't their kids have 2 or 3 chocolate bars? But you just have to get through it. The second point is around the images that are around us in society that are deemed to be attractive today in society. So I know of situations where I would say sufferers manage their creon to keep their weight down, to look thin, so that they fit into society or what society deems to be attractive, which is not good. And again, what can you do about that as a parent? Another part of that is ignorance of peers. Because he's different, he's a prime candidate for bullying. He hasn't been bullied. He has one girl not want to sit by him because she didn't want to catch his CF, at which point you want to go and warmly shake her by the throat. But kids like being sheep. They don't like being different. But I think it's character building, and at the end of the day, he doesn't have a choice. He is what he is. So pressures on the family, basically the effect on us, well, not constant worry, but there is always a little bit of worry there at the back. There's a little bit of a dark cloud. If anybody coughs in the room, you're homing in to see who it was, and was it Edward? And was he choking or was he coughing? And if it was choking, it's fine. Issues with siblings, potential jealousy over the attention they get. At one point, we had a food competition in our house where my daughter was trying to eat as much as he did in terms of chocolate bars, and then started to put on weight. And then what can you say to a 15-year-old girl that she maybe slightly need to do something about her weight without wanting to go down the whole eating disorder road? So we didn't go there. And another thing, the effect on their friends. Ed's friends are very protective of him, which is a good thing, which is great. So in the end, he has great friends. So he has a lot on his plate. He has a lot to deal with, as well as the normal growing 10 centimeters in the year, not knowing where the end of his limbs are, so he's so clumsy, which is normal, and the whole rewiring that's happening in his brain. So we also notice the self-awareness of himself and of his condition. We have the wonderful Facebook, the tweets, the Twitter, the YouTube, the Instagrams, where there could be information, some of it accurate, some of it not. We have other forms of information getting to your child that you have no control about. So you have to trust that if they do read or see something, they come to you, or you have an open relationship that they talk to you about it. He's becoming aware that there may be issues with his long-term health, potential of diabetes, having to have help in terms of reproduction, having kids, was a particularly toe-curling conversation with a doctor. He might have issues partaking in normal sports, not that he does now, touch wood again, and career choice limitations. He's disappointed already. He was desperate to join the army, and he knows he can't join any armed forces because they won't take people with a condition. So what next? So we've gone from a journey of care from the nurses teaching us what to do as parents, the parents, us, administering everything to Edward and organise everything around him, to the future, which is Ed to Ed, with lots of support. We'll still be there. His team will still be there. So there's been so much good news today and so much promise. We're the CF community is very encouraged by all the progress that's happening, and we're just waiting for the good news because we're ready. We're very ready. And that's it. Thank you.
Thank you very much, Thia. That was marvellous. Now, last but certainly not least, Thia mentioned the wiring of teenagers' brains. Well, for those of us privileged to have teenage kids or have had teenage kids, we know what she means. And who better but to help us in that respect, to invite to the stage Dr. Mandy Bryon, consultant clinical psychologist at the Great Ormond Street Hospital, to talk about adolescent motivation, neurological and emotional. Thanks.
Thank you, Ed, and thank you, Janet, for inviting me to speak on this topic. As Ed said earlier, we know that the adolescent period in cystic fibrosis is one in which the young person is vulnerable to health deteriorations. And we also know, and hearing from Thia just now, great talk, that it's an anxiety-provoking period for parents too, when your child who was compliant and responsible suddenly starts to become non-compliant and irresponsible, and more importantly, your power of influence over that individual starts to diminish. So, just so we're all on the same page here, one of the interesting things about adolescence is that it isn't a phase that's marked by age, it's also marked by a set of behaviours and attitudes that we all recognise and understand. And it's these that I really want to talk about. I just wanted to set the scene a bit in terms of the health paradox of adolescence, in that measures on most health attributes indicate that adolescence is the healthiest period of the lifespan, healthiest, most resilient in general. Improvements in strength, speed, reaction time, immune function, increased resistance to cold, heat, hunger, and dehydration. I could go on. And yet, overall morbidity and mortality in the adolescent age group, increases 200 to 300% from childhood. Why? There are features of adolescent behaviour that are linked to poor health outcomes. And these are marked by, simply, increased risk-taking, sensation-seeking, and erratic behaviour. And as Ed said, I'm going to come on and talk about the wiring of the brain and why this comes about. Because the primary causes of death and disability in the adolescent age range are related to problems with control of behaviour and emotion, not ill health, but control of behaviour and emotion. Because the causes of death in this and disability are accidents, suicide, murder, frequently happening 1 a month in London, stabbings, alcohol and substance use, violence, reckless behaviours and eating disorders. So, we know that adolescents with cystic fibrosis behave just like their peers. Their brain changes are the same as their peers. So could we say then that a contributory cause of adolescent and early adult morbidity in cystic fibrosis related to problems of control of behaviour and emotion? So the focus of our supports, assessments, treatments with people in this phase of development with cystic fibrosis should not just be medical. It needs to take account of the fact that it's a stage of development where things are changing rapidly. And also just wanted you to know that this lack of control described in behaviour is not new. Adolescence, the term might have been coined in the 60s, but adolescents and teenagers weren't invented then. That William Shakespeare recognised in this quote here that I would that there were no age between 10 and 23, for there is nothing in between but getting wenches with child, wronging the ancientry, that's us, stealing, fighting. What's really, really interesting is that Shakespeare got the age span exactly right, between 10 and 23, rapid stage of brain development. No other time period apart from in infancy is there that much rapid change. And so this transitional phase between the child brain, if you like, and the adult brain is what I'm going to talk about, because there are specific brain changes that underpin some behavioural and emotional tendencies and the problems that then emerge in adolescence, which obviously then impact with cystic fibrosis. So these are the structural brain changes in these transitional years between about 10 and 25, when everything is completed and the brain is as it's going to be in adulthood and then deteriorates from then on. In that the prefrontal cortex is restructured, and the impact on intelligence or on cognitive abilities is that this leads to the development of critical thinking and decision making. So during this transitional phase, that's not necessarily happening well. This is the point. Thinning of unused neural connections and pruning of synapses. So if you don't use it, you lose it. Because that produces increased speed and enhanced information processing, high-level control of behaviour. In this phase, again, not all there, all in the process of being developed. An increase in myelination, which produces integration of neural circuitry that allows modulation of behaviour. So again, the opposite is true during this transitional phase. So therefore, by implication, this changing brain means that is why we see these sorts of behaviours. So this difficulty in interpreting emotional expression, this is why we see increased rates of aggression, violence, potential gang murders, etc., because of a contributing cause is an inability to accurately interpret the intended emotions and the intent in interactions. Uninhibited and impulsive responses lacking in reasoning. You know that sounds like every typical teenager, adolescent. Need to be argumentative. Difficulty regulating negative emotions. This is what you see, the emotional ability going from being completely quiet and placid to off the scale in moments. And this ability to be able to consider long-term consequences. And we know that in cystic fibrosis, prevention has been the key from the word go. And prevention is not a buzzword in the adolescent phase. Putting off now for rewards later doesn't happen. So it's not that our teenagers, adolescents actually intend to pursue health risky behaviour. It's just that they're open to it. So this is what we're moving to. This is what your brains can do. Mature adult brain is capable of what psychologists call executive functioning or executive cognitive functioning, in that we see improvements in problem-solving, reasoning, response inhibition, and attention allocation. Executive functioning is your administration, your organisational skills, being able to do things like regulate your mood, being able to make decisions, put all the pieces into place in order to make considered decisions about actions. Being able to control your impulses, to respond when appropriately, not just because you feel like it, and being able to plan ahead and organise yourself to be able to plan. Consult with people in a reasonable way about planning. So the issue we have in terms of working with adolescents is that adolescents, as we've seen from Thia's son, they look like adults, they might want to behave like adults, but generally the mistake we make is that we want them to act like we act, and they can't. It's impossible. So when Mum says act your age, what she really means is act her age. That's exactly true in terms of our interactions with the teenagers and young adults. So Thinking, therefore, about neurological motivations of the adolescent in terms of the title that I was given, that actually executive cognitive functioning, this is about the assessment of the reward or approach in terms of planning, and then avoidance of harmful outcome, is not fully developed. It's obviously a developmental range of when that's achieved, but it's in construction. It's not fully built yet. So that immature executive cognitive functioning means that you may have almost the opposite, high sensitivity to rewards and a low sensitivity to risk. And so we could then propose that motivations are, in the teenage group, reward seeking. What can I do that's fun? And actually avoidance to the barriers to those rewards. That means you as parents, us as healthcare professionals. So as you know, argumentative but not rational. So what are the rewards then that adolescents are seeking? People with cystic fibrosis are normal human beings, normal individuals, like with this 1% thing, that they're actually out of contact with health professionals 1% of the time, the rest of the time just want to be normal. So their motivations are exactly like their peers. And like Joe said in his video, that actually he doesn't want to have conversations generally with people with CF. He just wants to be accepted with his peer group, doing all normal social activities and achieve in life everything that he wants to do. Their strong motivation, a reward is to just being like their friends. Strong peer identification. Friends don't have CF, aren't doing treatment. How do they fit that in? And like Joe said, it's a struggle to put that into compartmentalise it somehow. A strong reward, exploratory behaviour, risky behaviour, having a dabble, engaging in smoking, drinking, all the things that your parents tell you not to do. Probably the biggest reward, seeking out sexual relationships or just being fancied. Just that's one of the biggest motivations in this young age group. And that also, what is a reward is the emotional separation from parents, this real sense of the self-actualization that was the top of that triangle that we heard from Jonathan earlier, that's it's about knowing that you're owning your own opinions. Up until this stage in life, generally, you've been accepting of your parents' ideals, your parents' values, and it's actually quite rewarding and refreshing when you get to that stage where your brain is able to develop its own thoughts and opinions, which often means a total rejection of everything that your parents hold true, completely the opposite. And then, of course, a big reward is the development of vocational capability. Psychologists like using long words. It means getting a job. Plans for financial independence, dreams of being an independent adult, staying alone. So you can see how, where can we make cystic fibrosis a reward? Where does that fit in that list? It's just so hard. So in terms of thinking about the pressures that maybe the teenagers, the young adults, are under in terms of just the stages of life. Joe's asked that question, how do you manage the pressures of life? And he sort of said, well, it's hard, you're just trying to get a balance. So the tasks of early adulthood, things like learning to live with a partner, starting a family maybe, planning, thinking about that big issue for cystic fibrosis, as Thia mentioned, her toe curling talks, starting an occupation, finding a social group. The pressures of CF, conspicuous treatments when absolutely what you want. It's actually what psychologists call the teenage, but the stage of the imaginary audience. That self-consciousness that Thia described. Constantly checking yourself with your peers. Am I the same? Am I different? I want to be the same. How far away am I from being accepted by that my preferred social group? So anything conspicuous that makes you different is potentially a problem. And remember, avoidance of barriers to rewards, so that's why treatments are often avoided. Reduced life expectations, fear of the future, maybe. It's like Joe's saying there, I don't really want to think about those things. I don't even want other people to know those things about me. I don't want to be pitied. Necessary relationships with healthcare services, so yet another set of ancientry who nag. And possible limitations of activity and experience. And what's interesting, that everything that Ed's talked about over these 2 days in terms of the future vision for the Cystic Fibrosis Trust's ambitions are really about trying to remove those as pressures and enable people to achieve and reduce those limitations that cystic fibrosis might place. So, nearing the end now, I do want to reassure you that adolescence really is just a phase, and I think Ollie said that yesterday, that he went off the rails a bit, but he's back on track. But that actually, to be understanding and fair, teenagers, adolescents, young people really don't understand all the reasons for cystic fibrosis treatment. Their brain isn't capable of absorbing that information and operationalising so that it can be organised so well. They absolutely won't have the capacity to properly assess your threats. So lots of parents will say to me, it doesn't matter what I threaten them with. And I said, well, threats aren't going to work, because threats are you preventing them from getting their reward. So they're taking their Xbox away, saying they're grounded, not being able to go on a sleepover, preventing them to going to festival, whatever it might be. That they will just, all they hear you is saying to them, you can't do what you want. So they don't have the capacity to think ahead, because what they don't do is to put off rewards today for the benefit tomorrow. They want the rewards now. And they will always think, what would my friends do, and not what would my parents or doctor do. However, it's a phase and it's essential. What Joe said was that he's found it really beneficial, even from a younger age, to be the one that was involved in those discussions with the doctors and nurses and physios. Because it's about training and supporting what Thia said. Well, it's ed to ed, but with those supports. So it is important that there is that training. The understanding that that brain restructuring might mean, even though they look like adults, they can't participate, but that's not a reason to exclude them. So finally, this is what we're hoping when they get through the end stage. Thank you.
Thanks so much, Mandy. That was really fascinating and really interesting. And I don't know if there's any particular, I think we might have a time maybe for one or two questions. If anyone has particular questions of Mandy or Thia? No? David.
Mandy, how do you avoid
Back down again. That's a very good question. It's really important that you do. It's a bit like the brain restructuring. I always say to parents, teenagers are like 2-year-olds in the way that they're responding. So that they want what they want right now. And that what we know is that if you respond to tantrums or you respond to confrontation, you fuel it. It's much better to say, I'm not having this discussion now, so this is not happening. Sometimes they are those kicking and screaming discussions, but the more, I think teenagers, in my experience, and my own who've now got through that phase, but they are absolute experts at being argumentative, and their arguments, as I said, are not rational, so you'll never win. So often the confrontation is better to say, we've gone far enough now, I'm backing off, we'll have to leave this till later. So my advice would be, don't fuel the fire, walk away.
Great. Thank you very much, Mandy. We're at the end of the conference, almost, and I've got great pleasure in inviting the chair of the Cystic Fibrosis Trust, George Jenkins, to close the conference officially. Thanks.
Thank you very much for that welcome. Mandy, I'm not really so sure I enjoyed what you've just said, because probably as the oldest person in the room, I recognise one or two of the traits that you've just described in me, rather than in my grandchildren. I'm delighted to see so many people here today. Thank you in particular for your commitment. And when I say commitment, I mean whatever that commitment is from you to cystic fibrosis, for your personal work that you do, whatever that connection may be. Thank you for that commitment and support that you provide to guys and girls going through this process. We've had 2 days of conference, I think a great conference, and the comments I've heard around the rooms and around the lunch period support that. And I would certainly immediately like to thank all of our speakers, our sponsors, and to Janet and the Cystic Fibrosis team too for putting together such a great conference. Perhaps you'd agree with that for me. I want to tell you a little story. That's an old phrase as well. It's a bit about my journey through cystic fibrosis. Bear with me. There is a point to this. I'll be honest with you. Cystic Fibrosis Trust was formed in 1964. At that time, I was one of those teenagers. I was demonstrated all of that and more. And I really do reflect that I had a fantastic years of teenage years. Living in London in the 60s when somebody had just torn up the rule book was a pretty good place to be. My mother and father didn't agree with that, and I didn't have cystic fibrosis, but no great shakes there. My dream, and certainly that I saw one of my children go through, but not the other, was that all teenagers should have as much fun, excitement, and great stuff that I did. Perhaps not everything I did, okay, to be honest. But great freedom, and the more that we can do as a trust and together, and with the help of all our clinicians and researchers, to actually start to move down that road of giving people an equality of life, I think that's what we should aim at. My freedom came to an end in the early 70s, I met and married my wife. We had a great life together and we decided to have children. I want everyone with cystic fibrosis to have that choice as well. And that's something else I think would be a great prize for us to work towards. But then the inevitable happened, perhaps one should say, and in a small room in a hospital, somebody told us what was wrong with one of our children. We didn't hear the words. The only words we heard were, and he won't last 5 years. Well, thank God he wasn't in the room, because he didn't hear it and he was having none of it. Adam made it with the help of a heart and lung transplant along the way. He made it to 17 years of age. He did pretty much what he wanted to do. And as a frail young man driving a large 4x4 in competitive off-road events, that was quite something to see. He passed his driving test on oxygen with a tank behind him, courtesy of the examiner. What that tells me, it tells me about the steel, about the character, about this will that I've seen in so many people I've met with cystic fibrosis. I've met a lot of people with cystic fibrosis and I consistently see that desire to succeed. We have to help them. We have to give them that opportunity. We heard from Jonathan King earlier this afternoon, and I had the honour of riding with Jonathan on the first few miles of that ride. I couldn't keep up with him. Determination, again. I'm fitter than he am. I know I am, but I still couldn't keep up with him because of that determination. There are so many people who demonstrate that determination and success in their life. Some of them huge commercial success. Success for some is just getting through the day, and that's pretty important too. We also now know that CF, because of the advances in treatment and where we're going, it's not just a childhood matter, it's not just an adolescent matter, it's now a life matter. Adults make up 50% of the population with cystic fibrosis in this country. So we have to find a new way of helping adults live and work with this condition. What I've seen over the last few days, and doing the job I do as the chairman of the organisation, I've seen the beginning of Cystic Fibrosis Trust in the 60s. I've experienced it very close and very personally. I'm excited, so excited and ambitious for what we can do now. What I now want to see is that the Cystic Fibrosis Trust is redundant in my lifetime. I want to see it beaten once and for all, done away with. Huge challenge, but actually why shouldn't we rise to that aspiration? The Trust is up for it. The team are up for it. Your trustees are up for it. Are you up for it? Pardon? Yes. Thank you. Because what we actually saw, and Thia referred to the catchphrase, a fight for a life unlimited. It is a fight. It is something that we've got to get together, form an army and beat, because together we are a very powerful group. The Trust has a great and powerful ambition, and we need everybody to work with us to achieve that. To join together as a community so that we are much bigger as a whole than we are as a sum of the individual parts. So I really do hope you've enjoyed your couple of days here, or a day, whichever it's been. It's been a great 2-day conference. Shall we start the fight? Are you up for it? That's better. Thank you very much.